What if your prescription history could predict your cancer risk? A new study out of Sweden just proved that it can, and AI is the reason why. I'm Chloe Kirk with Biotech TV, let's talk about it. Melanoma is the most dangerous form of skin cancer, and its incidence has been rising in Western countries for 50 years straight. Catching it early is everything. Survival rates drop dramatically the later it's found. Here's what researchers at University of Gothenburg and Chalmers University of Technology set out to do. They asked whether AI could identify who is going to get melanoma before it happens, using only the data healthcare systems already are collecting. The data set was the entire population of Sweden, over 6 million people. No special scans, no new biomarkers, it was just age, sex, medical diagnoses, medication history, and socioeconomic data. The kind of data that is sitting in every modern healthcare system. Of those 6 million people, nearly 38,600 developed melanoma over this 5-year study window. It's about 0.64% of the population. A rare outcome, which is exactly what makes this so hard to predict, and why AI becomes so valuable here. The team tested 4 machine learning models, logistic regression, random forest, gradient boosting, and a neural network. The winner was this gradient boosting, using all these different variables, and it correctly distinguished future melanoma patients from non-patients in about 73% of cases. When they stripped it back to just age and sex, that dropped to about 64%. That's the power of including diagnosis codes and medication in that 10% gap or so. That's the AI doing the work humans couldn't manually do at this scale. Where this gets really exciting is the model flagged its highest risk group, the small subset of people who hit the most risk signals. 1 in 3 of them actually developed melanoma within 5 years. 1 in 3. Condition that affects less than 1% of the general population. That is a dramatic signal. The lead researcher put it clearly, that this could enable selective screening of small, high-risk groups, more accurate monitoring, and far more efficient use of healthcare resources. So instead of, say, screening everyone equally, you direct your resources to where the risk actually lives. Now, this is important to say. The team is explicit that this is not going to be deployed to clinics tomorrow. More research is needed, and obviously policy decisions need to follow. But as a proof of concept for how AI can bring population-level data into precision medicine, this is a really cool study. And what makes it a textbook case for AI in health isn't the result necessarily, it's the approach. They didn't build an expensive new infrastructure, they used what already existed, that registry data, the routine healthcare codes, and they turned it into a predictive engine that could one day tell your doctor, this patient needs a closer look. I'll see you next time.